So next one is the equilibrium test. So these tests are going to be performed in the, you have to do in the standing positions, especially in the standing positions. So these tests are going to give the, how the balance is there, how is the equilibrium is there. So we are going to identify who are having the weakness or any loss of balance problems. So we are going to identify these special tests. So these the special tests are going to be have to do in the standing positions. So these standing positions. So in the standing, the patient has to be comfortably stand and also with a normal base of support. So if who are can stand with the normal base of the support, so it's indicating the they're having the balance control. So it's not a damage to the, that means like any abnormality in the cerebellum. So who can stand with the normal base of support or narrow base of support, it indicating the normal balance and also it indicating the normal cerebellar functions. And also next one is we have to give the variations after normal base of support. We have to ask them to do the narrow base of support. That means ask them to close the both feet together. So ask them to stand. So who are having the weakness, so they are going to get the shuffling, they are going to get the shivering. So if, for example, the right side cerebellar hemisphere involvement, so they are going to lean towards the right side, or maybe they are going to be fall towards the right side. So they may chance to get the shivering towards the right side. So it depends upon the involvement of the cerebral hemisphere, cerebellar hemisphere. So if it's the damage in the right cerebellar hemisphere, left cerebellar hemisphere, so they lean towards the left side. So that is the involvement of the which lobe is, which side of the cerebellum is involved. So coming to the another like a test is the standing in the tandem positions. So ask them to do the draw one line. So in the line, so the patient has to stand on the one hand, one leg to the forward, another leg to the back side. These are tandem positions. So these tandem positions are acting on the like on the one line, single line. So with one foot directly in the opposite directions. So that means if any person, if he put the one leg here, so next immediately they have to put the leg in the behind to the heel regions. So the if for example, if the left leg is front side, so the left near the right toes should be the close to the left heel. So they have to stand in the one line. If the one line, if they draw one line here, so here, so they have to stand on the one like a one line. So if who can stand in the tandem position perfectly, so that means their balance is the normal. So it indicates the normal cerebral functions. And also standing on one foot, so who are having the like a strength and also coordinations and balance, so they can able to stand on the one leg. So if any damage in the cerebellum, so they are unable to stand in the one leg, so may chance to get the fall down. So that is about the specialist test for the equilibrium. And also arm positions may be altered in each of these above positions. So that means, so first one is we give the normal base of support. So again, we can ask them to the normal base of support standing. So we have to alter the arm positions or hand positions. Ask them to one hand up and one hand is down. So these positions is because going to be changed is a gravity and also is the line of gravity and also base of support. Center of gravity is going to be altered. So if the normal person, they can change the hand positions. One is up and one is down. One is the up, one is side. So they can maintain the body positions. So this one is they can maintain the equilibrium. But who are having the like a less equal or in the incoordination, they are unable to maintain, may chance to fall down. So it indicates the impairment of the coordinations. And also we can ask them to do the reach the hands forward. If we raise the hands forward and upwards and downwards and backside. So if we change the hand positions, may alter the balance and also may alter the coordinations. So it indicates the impairment of the coordinations. And also other special tests are the perturbations. So perturbation means the displacement of the balance in unexpectedly. So if the patient is asked them to stand with the hands are closed or with the eyes closed, if the therapist or if someone comes, if they try to push forward, the normal persons, so how the response will be they're going to control the balance. Maybe they can shuffle forward, they move forward, but they can control the balance. They won't get a fall. So, but who are having a cerebellar injury, so if we give the like a push or thrust, so may chance to get the fall down. They lean forward and also they may chance to get the fall down. So which side we are going to give the push. So for example, from the back side, if you push from back side, they may lean or they may fall forward. or they push from the side to left side, so they may lean or they may fall towards the right side. So this condition is called as the perturbations. So this is nothing but these are all tests are is we have to check and we have to analyze the where having the abnormality. And also next one is we have to do the standing functional reach positions. So in the standing functional reach positions, so here we have to do the forward trunk flexion with the upper extremity reach. So if you see here, the patient should be in the stand, so in the neutral position, initial positions. So ask them to lean forward and also try to reach the task one. So try to reach the any, like if you give any task like a point, or if you ask them to any color, any point. So if they reach there, so we have to check. So how is it balanced? Is there any changes in the balance? Is there any abnormality in the body postures, or maybe shuffle, or maybe shivering, any tremors? So we have to identify during the standing in functional reaching positions. And coming to the standing, lateral flex trunk to the each side. So in the standing positions, ask them to stand properly, and also ask them to raise the one hand and lean towards this right side as well as the left side. So these things are going to be, so we're having the weakness are also in coordination. So that side they may chance to get the lean or maybe chance to fall down. So another important function is the Rambuk signs. So another important assessment is the Rambuk sign. So these are going to be ask them to stand the persons in comfortable positions with a narrow base of support. The feet should be close together. And also first we have to ask them to eye opens and then ask them to do the eye closings. So standing, eyes open with the feet together. So after that, we can ask them to eyes close and also eyes closed. Feet together, eyes closed in the standing positions. They are going to get the shivering, or they may lean forward and backward, or maybe side to side. They are going to get the like a shivering movements. So this indicating the Rambag signs positive. And also after that, the progression, we can ask them to do the standing in the tandem positions. So that means we can draw a one line. So ask them to stand on the line. So then after that, asking them to open the eyes. Then next we can ask them to close the eyes. So have to observe, is there any abnormality, or is there any like a changes in the like a body position, any shuffling or any deviations of the trunk. So we have to identify. So if it is positive means, so those patients having the incoordinations or impairment of the coordinations. And coming to the tandem walking positions, so place the heel and one foot directly. So this also we have to ask them to try a one line. So ask them to do in the tandem walk positions. So and also in these positions, so ask them to do we can do the alter the hand movements. So we can in the tandem walk positions, one hand forward, one hand backside, one hand is the sideways, one hand is the upwards. So these alternative hand movements also going to give the alteration in the body postures. So these are the special tests. So we are going to assess the patient's coordination easily. So these are the like a assessment of the coordination test. So it will help to it will help to analyze the which movements is either because of the trunk muscle weakness or lower limb muscle weakness or upper limb muscle weakness, or because of the any exactly like a central involvement, any cerebellar involvement. So we can analyze. So according to the patient conditions, we are going to give the treatment plan. Maybe if you observe here, so these are also what we give all the assessments, all the special tests. We are going to perform in the treatment plan also. If you train properly, these are all whatever. If the patient is unable to standing properly, so then we can try to give the standing with the normal base of support and also is a narrow base of support. This is nothing but also is a training for the like a coordination training. So this also we are going to use for the like a assessment purpose. So that means the special test we are going to assess who are having the abnormality in the equilibrium and also coordination. The same thing also if you want to train, also if you want to improve the like a balance and posture and coordination, the same special what we applied for the assessment, this test also we are going to give for the treatment sessions. So these are the like a special treatments and also special assessment and also treatment technique for the coordination exercise.